Hi, I'm Dr. Daniel Gordon. Welcome back to The Health Perspective, the channel where we have real conversations about health and well-being based on the types of conversations I have with my patients in clinic on a daily basis. And this channel is my attempt to bring those intimate and helpful discussions to a wider audience. Today we're talking about weight loss medications, specifically the new GLP-1 medications, Wegovy and Mounjaro, which, as I'm sure we all know, are creating a huge buzz in the health and well-being space. Sometimes for the right reasons, sometimes for the wrong ones. I'm not going to discuss the scientific data or political ramifications of these. You can get that from lots of other places, or if you want, I can do a whole extra video on that. What I am going to do is to dive into one particular conversation that I keep having again and again with people. And this is the question that starts it off. Should people take weight loss medications if they are just going to regain the weight when they stop taking them? Now, on the surface, it's a great question, completely reasonable. After all, we're in general looking for the best long-term strategies for our health and not short-term solutions or sticking plasters. And I think that some people do see these medications as sticking plasters for weight in that they help people lose a lot of weight for a short period of time, like a year or two, and then they can regain it again afterwards. But I think that this perspective, the sticking plaster perspective, oversimplifies a complex issue and it overlooks some of the real struggles of those who actually need these medications. First off the bat, I want to say that from my personal perspective as a doctor, and I have in my role as a doctor, I have helped people lose weight using these medications. From my personal perspective, the people who are coming in to see me are not looking for short-term solutions or short-term fixes, but they're also fed up with the willpower arguments. They're coming to discuss these medications after exhausting countless other strategies, strict diets, exercise regimes, behavioral therapy, and more. In general, the people who I am seeing who are interested in these medications are not looking for an easy, quick solution. But if we are going to help them, then we have to be honest that if we look at the pure scientific data, it does indicate that there is a good chance that people who lose weight on GLP-1 medications like Wegovy and Mounjaro will regain it when they stop taking those medications. And that data is based on scientific studies. But before we make a foregone conclusion, it's important that we factor in a few very important arguments. So I'm going to go through these one by one. Firstly, the value of reducing your exposure to a high body weight. So the problem with obesity or being overweight is your cumulative exposure to high body weight. That means your body's exposure over time to that high weight. The longer that you're able to maintain a healthier weight, the lower the cumulative strain on your body, on your heart, on your joints, on your metabolism in general. So even if the weight is eventually regained, those months or even years at a healthier weight can offer you meaningful health benefits and even possibly reduce the risk of you getting weight-related health problems in the long term. The second thing is that sustaining weight loss versus losing weight loss argument. So it's well known that losing weight is hard. It's very hard, but it's considerably harder to lose weight than it is to maintain your weight. By helping people lose weight in the first place, medications like Wegovy and Mounjaro can put them in better positions to maintain their weight in the future rather than continually struggle to lose weight to reach a target. The way that I describe this to my patients is that taking these medications gives you a window period, a year or a couple of years, when you can where you're giving yourself the best possible ingredients for your future health. But you have to use that time to implement all the other strategies like improved nutrition, healthier sleeping habits, and regular exercise. That way you'll give yourself the best chance of success when you stop taking the medication. The third thing is that I'm a big fan of challenging foregone conclusions. I think fundamentally people do have the capacity to change over time, and no one's path is fully predetermined. So we shouldn't write off a treatment just because some individuals will regain weight. Some people, even if it's a minority, may be able to use the opportunity to build better health and habits for the long term. And remember, by the way, that progress anyway isn't linear or permanent, but every step forward matters, even if there are a couple of steps backward afterwards. And The analogy here that I would give is like an antidepressant. If someone came into my office with severe depression, I wouldn't deny them an antidepressant just because there's a chance their depression may return later. Likewise, I don't believe in denying someone effective weight loss tools, someone who needs those weight loss tools, simply because the weight might come back once the treatment stops. Ultimately, I'm all about giving my patients the best possible chance to improve their quality of life here and now, as long as it's safe, rather than withholding help based on hypotheticals in the future. So, are these medications a quick fix? Absolutely not. But if you're using them as part of a broader strategy to improve your health and well-being, then they do have the potential to help people, many of whom have struggled with their weight for years. And that's the thing. Although these medications have only become available in the short term, like literally the last few years, for many people seeking the medications, the story of their struggle with their weight is much longer, sometimes decades or more. And that's what we have to understand. So, if someone discusses their intention to try a weight loss medication with you, don't judge. Remember that their story may be longer than you know. This was the third episode in my series of The Health Perspective, but I'm still learning how to do this best and what's helpful for you. I'm not chasing likes, comments, or subscribers, but if you are actually finding this helpful, doing one of those things is going to show me that this is worth continuing. Thank you for watching. See you next time.